Why is flu prevention critical for immunocompromised people? Imagine fighting a battle with a weakened shield. That's what it can feel like for people with compromised immune systems when the flu comes around. Their immune defenses are not as strong as those of healthy individuals, making them more vulnerable to catching the flu and experiencing serious complications. People with conditions like HIV, those undergoing chemotherapy for cancer, organ transplant recipients, or individuals on medications that suppress the immune system are all at higher risk. Because their bodies can't fight off infections effectively, even a common flu can turn into a severe illness. When someone with a weakened immune system gets the flu, they are more likely to develop complications like pneumonia, which is an infection of the lungs. They may also experience longer illness durations, sometimes lasting weeks, and requiring hospitalization. The flu can also cause secondary bacterial infections that are harder to treat in these vulnerable groups. This increased risk makes preventing the flu in these populations a top priority for public health. Another important factor is that these individuals tend to shed the flu virus for a longer time than healthy people. This means they can spread the virus to others for an extended period, which is especially concerning in healthcare settings or crowded community spaces. To help protect them, vaccination is strongly recommended. The vaccines used are inactivated, meaning they do not contain live virus, which makes them safe for immunocompromised people. Live vaccines are avoided because they could pose a risk of causing illness in these individuals. Healthcare providers often recommend that immunocompromised patients get vaccinated every year, ideally at specific times based on their health status. For example, some transplant recipients might need to wait several months after their transplant before receiving the vaccine to ensure it works best. Besides vaccination, infection control measures like wearing masks, practicing good hand hygiene, and avoiding crowded places during flu season are crucial. Healthcare workers also play a vital role by getting vaccinated themselves and following hygiene protocols to prevent spreading the virus. In summary, preventing the flu in immunocompromised individuals is essential because their weakened immune systems make them more prone to severe illness, complications, and longer periods of contagiousness. Vaccination with the appropriate inactivated flu vaccines, combined with strict infection prevention strategies, helps protect these vulnerable groups from the serious consequences of influenza. Always consult healthcare professionals for personalized advice and to determine the best prevention plans suited to individual health needs.